right, we are going to go ahead and get started. Welcome to those who are here or watching later. I'm Erica. You probably already know me, the admin of this group, and we're really excited to have our panel of experts tonight to talk about picky eating and the complex factors affecting food acceptance. So I just want to let you know who everybody is, and then they're all going to take their turns to chat. And of course, as always, we'll be taking some questions at the end, so you can throw them in the chat or hold on to them. So first up is going to be Kristen Quinn. Hi, Kristen. She is the owner of Toddlers and Tomatoes, although she works with ages above toddlers. That's just the business name. And she is a feeding consultant. So she'll be helping us understand how to know if it's something that needs intervention and who you might get that intervention from. We also have Kara, and she is from Talk, Eat, Play, Grow. She's a speech language pathologist, so she'll be sharing some thoughts from her perspective. And we have Casey and Alyssa, who are both from Play at Home PT. Stephanie's watching too. She's the owner of Play at Home, and they are occupational therapists that tackle this from that angle. So we're going to hear about all aspects of this picky eating, or whatever we want to call it, and strategies we can implement with our children and all ages of children, because they all have different specialties. So thanks for joining. Think about what your questions are. And Kristen, I will kick it over to you.
Thank you, Erica. Thanks for having me tonight for this a fun discussion for me. My name is Kristen. I have been working with families who have some difficulty with feeding in one way or another for close to 20 years. And when I was thinking about that earlier, that made me feel very old. But it's been quite a while that I've been working with families who struggle at mealtimes for a variety of reasons. I started off at the Children's Hospital of Philadelphia, and in my role there, I was a behavior therapist, and I would implement behavior protocols to increase acceptance of food or volume of food, or sometimes both. And in that capacity, I worked on a multidisciplinary team with a physician, a dietitian, a speech therapist, occupational therapist, and all of these areas would play a role in what the treatment plan was and how the feeding issues were addressed. And of course, most of the families who came to the CHOP program had other medical concerns that led them to our program. But what I noticed while I was working there was that these families were, no matter what the reason was that they were in the program, the families were really stressed out. And, eating is such a big part of life. It's, all day, every day, we need to be eating, to be healthy, to grow, to maintain proper weight, especially with young children. And that can be really overwhelming for any family. When I decided that I wanted to sort of scale back my full-time work and stay at home with my own children, I really didn't want to give up working with families who are dealing with these feeding issues, because I really felt that the parent support was something that I could run with from independently outside of the hospital. And what I strive to do in my service now is support families who are either haven't connected with the proper resources, don't know where to turn, or really just
It's a video?
I can't hear her. I heard her a second ago.
I can't hear Kristen yet.
Kristen, I muted you by accident. Unmute yourself. Sorry, I misclicked. Just go back one sentence.
Sorry, I didn't notice.
I was trying to mute somebody else that just joined.
Here, do you want this?
So
if everybody besides Kristen could go mute themselves so I don't misclick.
No.
Let me start.
So if you think about picky eating, it's I really tried not to use that phrase because it kind of diminishes the stress that a lot of families are looking or needing support with. Oftentimes, if there are no other medical diagnoses and no real identifiable reason for the struggle at mealtimes, if a worried mom or dad goes into a doctor's office and says, I'm worried about my kid, they're not eating, and the doctor looks at the charts and all the numbers are good, they say they'll grow out of it, or it's not really a big deal, they're fine, or in some way the family's not heard. I hear you're stressed out, you need help, and this is how I can help. Because that's not, in the pediatrician's office, as far as they're concerned, if the child is growing and healthy, then it's going to be okay. And it might, but that doesn't really help the family at the moment that they're feeling that stress. So I wanted to share a chart, if I am capable of doing that, that sort of illustrates some new diagnoses, which were not, I had stopped at CHOP in 2012, and these diagnoses came about just after I left. Let me see here. But I think that many of the families that I see are really right here. They're really feeling a disruption to family time, disruption at the table, disruption in their relationships. Everybody's stressed out. Nobody's looking forward to eating. They need help. But again, if the doctor isn't seeing any issues with nutrition and growth, they might not be able to offer any meaningful support. So I think most of the families that I see are definitely dealing with these psychosocial concerns, sometimes the nutrition. And I think many of my families are here in the avoidant restrictive food intake disorder realm, but that doesn't mean that they haven't been or are going over here to the pediatric feeding disorder realm. But that is usually that's when it's easier sometimes to hook up with resources, because there are clear either skill deficits or medical concerns going on, that it makes it easier to say, hey, you need an occupational therapist, you need a speech therapist. So the people who I see either don't know that those things exist, or they haven't, or some of those issues haven't come to the surface yet. So what I do is kind of talk through what's going on, what they're seeing at home, what they've tried, and help them connect to the people that can help them further. Sometimes the families that I see just want somebody to listen to them, and I can do that. And they just need a few tweaks in the home environment, and I can do that. But sometimes they need more help, and that's when I refer out to some of these other wonderful people that are in the discussion tonight. So that is what, how I help families. And I found this is on feedingmatters.org. So if you are feeling like you're not sure where to turn, I'm so glad that they finally put a label to these things, because it was really helpful for a family who's looking for resources to have a name for the things that they're experiencing. So if you want to check it out for yourself, you can go to feedingmatters.org. There's a ton of resources there. I think that is my spiel, Erica. If somebody else would like to. Oh, you're muted, so I can't hear what you're saying.
I'm doing terrible with my muting and unmuting tonight, like I've never done this before. Let's play expert roulette. Kristen, I will let you kick it over to the next expert.
Let's go, Kara.
All right, Kara, go ahead, introduce yourself.
Hi.
We're happy to hear what you have to share. I will mute myself again.
Yeah. So I just want to quickly introduce myself. Thank you guys so much for having me. My name is Kara Fox. I'm the owner of Talk, Eat, Play, Grow. I'm a speech language pathologist. I'm also a mom and a wife as well. I've been a speech therapist for about 8 years now, and most of my experience, given just job placements and where I have worked, has been in feeding. So I worked in local pediatric hospitals, Nemours Alfred DuPont Hospital for about almost 5.5 years. Before that, I worked at Jefferson in the city. I've worked with babies, infants, up through toddler and young adulthood as well. Throughout my experience as well, I've been parts of feeding clinics, similar to what Kristen said, a multidisciplinary clinic, which I feel like fits this topic really well, because one of the most important things is a multidisciplinary team approach to this. And, you know, the clinics that I ran there were a psychologist, speech therapist, a pediatrician, a nutritionist, occupational therapist. Everybody was involved. So I'm so happy that we're all here kind of giving our 2 cents and our expertise on this as well. And briefly, I don't know, I'll just kind of talk about my role in this whole process. And I'm sure that Casey and Alyssa will touch on similar roles as well, but I'm just part of that multidisciplinary team, helping to to diagnose this disorder and kind of differentiate between, you know, this avoidant restrictive food intake disorder, or that's extreme picky eating, or just a pediatric feeding disorder. As speech therapists, we do feeding evaluations to assess oral motor skills. We also do behavioral feeding, sensory feeding approaches, as well as swallowing treatment as well. So one of the big things that I'm sure we'll kind of touch in on as Christine guides the discussion is how do we diagnose and how do we kind of look at all these different areas to decide, okay, where do these children fall? So we do feeding evaluations, again, to determine any oral motor dysfunction or any need for an assessment of the swallowing function. I used to do the swallow studies at the hospitals as well. And as Kristen touched on, you know, if there is any medical or skill dysfunction, then we can kind of put treatment down one alley. And if there is no skill or medical dysfunction, we can kind of go down a different approach. The treatment strategies are different, but I think the biggest thing, and one of the reasons why a speech therapist is part of the team, is to determine any skill or medical dysfunction, as well as assess behaviors and family environment, mealtime routines, daily routines, meal intake routines. All of that is super important when it comes to any feeding behavior. So we kind of can help look at all of that. The other part is we also just rule out dysfunction as well. There's many times that I've had to, you know, Kristen mentioned that it's so nice to have these details of where these diagnoses fall, because part of it is rule out too. So we do the feeding evaluation, we do the modified barium swallow study to rule out any dysfunction as we are on the journey to diagnosis for a lot of these families. So that's my role here, and pass it on to Casey.
Hi, everyone. I'm Casey, and I'm an occupational therapist with Play at Home. Come August, I'll have been in OT for 5 years. Time flies when you're having fun. I've mostly been in peds, and I've done a lot of feeding from an outpatient perspective, as well as early intervention. So that Birth to 3 program that's run by the state, and I do a lot through Stephanie's company as well for, you know, home health. And so from, you know, an OT perspective, there is a lot of overlap where you'll see like kind of what Kara touched on, because feeding is so complex. There's so much that goes into it. You can't isolate, you know, one part of the puzzle from the other. It's, you know, it's not a 2-step process of sitting down and then eating. There's so much that's going on in play. There's internal organs that have to function properly. From a sensory perspective, the child needs to be able to even tolerate the sight of food. I usually start off with telling families that, you know, we eat with their eyes first. So if a child is really having a hard time just kind of looking at the food, then like we might need to start there. So it is really important to have that multidisciplinary team looking at it to see, you know, is there a sensory component? Is there something going on oral motor wise? Do we need multiple people on the team to brainstorm and problem solve to find these puzzle pieces so we can fit it all together, so we can get your child to be a more adventurous eater, get the nutrition that they want, and take some of that stress off you as a family? Because I know that's definitely one of the biggest pieces is for me, and I'm sure to all the therapists here, as part of my treatment. You know, I'm, you know, treating the child, but I'm also treating the family as well, making sure that I can take some stress off that meal time. And that includes taking stress off the child too. So kind of making sure that the environment is positive, that we're not putting too much pressure, and we're just interacting with the foods in a positive, playful way. It's okay to play with our food. It's great to play with our food and get messy. So I know that like we have some strategies Alyssa and I can share with you, but I kind of want Alyssa to also like jump in and give some insight to anything that, you know, I didn't mention from an OT perspective.
Yeah, Casey and I are tag teaming the OT. But I'll quickly introduce myself. I've been an OT for about 6 years. Now I'm with Play at Home, but I'm also an early intervention provider in Philadelphia County, and my background is in outpatient, inpatient, school-based, and now currently early intervention, as well as telehealth, all pediatric over the past 6 or so years. So Casey and I wanted to discuss some common strategies that we use to help families through some of these feeding challenges that we use mostly with our practice with toddlers, but to many other ages as well. Casey, do you want to talk about strategies to make a predictable mealtime routine?
Yeah, absolutely. So I know Alyssa and I are both, we do this pretty much with all of our clients. It's obviously going to be, you know, patient specific, but it's really important to have a predictable routine so the child anticipates what's coming next. Because sometimes kids just go into a fight or flight response and you don't even know why. So if we can help them anticipate what comes next, it's easier to kind of transition. So with a predictable routine for mealtime, it's, you know, setting up like, we're going to wash our hands first. So we have that beginning. So they know that we wash our hands and then we go sit down. Having them offer foods to, you know, the family, whoever's sitting at the table, helping them scoop the food onto the plate. Again, kind of like that beginning, middle, and end. Like, now this is what we're doing. Then we sit down and we eat. And then having that end piece being cleaning up, so that again, they know that the meal time's all done because we've cleaned up the table, and now we can go play or do whatever, you know, as part of your family routine after that. And if you can, even before the meal time, having your child help meal prep with you in a, you know, a safe and child-friendly environment, can be so key, because the child's able to learn about food without the expectation of having to eat it. You know, I'm stirring, so I get to watch the food mix together. I get to see, you know, the vegetables, you know, I can help cut it up if you have a kid-friendly knife, if it's age appropriate. So they can just learn about the properties of the food, again, without having, you know, with the expectation I'm sitting down and now I need to eat this, but making it positive in that regard.
And some other strategies for a predictable mealtime routine would be how the parent is interacting with the child as well. So we really want the parent to be modeling some good eating behaviors, as well as, especially if there's a new food being introduced, we want to make sure that that child is seeing the parent, the grown-up, eating that food and trying that food first, because most kids won't try a new food if they haven't seen someone else eat it first. So that modeling of good eating skills is really helpful for that middle part of that predictable routine. And then another really big issue that I see a lot in the community is screen time. So we really want to not have any screens, no TV, no iPad during meals, because we really want the focus to be on that social time with the family, as well as on the food itself, and really capitalizing on having the child's attention on the food. If we're not eating yet, that's totally fine. We can be playing with it. We could be making food art or interacting with it in some kind of way, just to avoid like mindlessly eating and not really focusing on the properties of the food if YouTube is on. I know easier said than done, but from a young age, trying to establish no screens for the mealtime. And then another part of the routine that parents can definitely think about is being mindful of the language that they're using during meals, trying not to put pressure on the kids to eat something, just take a bite, no dessert if you don't try this, but instead trying to keep things positive. Great job for trying something new. Or if the child, tried something and spit it out, you can say, we're still learning about this food, and just trying to keep it really positive. So those were our tips for creating a positive mealtime routine. Next, Casey, do you want to go into the next section?
I love that. Thank you. If I can just jump in. So just to emphasize for the skeptical parent, even though like maybe historically we were taught not to play with our food, you, the experts, see that can eventually turn into food acceptance, and we maybe have to like make peace with it and let it play out.
Yes, absolutely. We want kids to feel what that texture is like with their hands first before we would expect them to tolerate that texture.
For some of us, that's probably harder than the no screens if we don't like messes with food.
Yeah. Sometimes I find it's the kid doesn't mind getting messy. It's more the parent. So I'm very mindful of that and just asking them, maybe let's start with one meal a week. Let them get messy. See how that even makes you feel. Strategies you could do for that is like having a sheet underneath the table, something underneath the table. So if it falls, it's a little bit easier to clean up, because we definitely understand not everyone, the parents don't want to get messy. So kind of being mindful of that, but educating also from the perspective that like what Alyssa just said, that's how we learn about the properties of our food. We know that it's when we touch it and we feel that it's hard, we know that it's going to be crunchy in our mouth for something that's soft. So we're eating with like I said first, we're eating with our eyes first, and then our hands, and then with our mouth. So kind of thinking it from that perspective.
Awesome. That's all.
Okay. So we also wanted to just touch on some common behaviors that we see during meal times with some of our kids that are, quote unquote, picky eating, problem feeders. So throwing food, that's definitely a big one. And it kind of goes into, the tolerance of the parent, like messy, like, oh, I don't want them throwing their food all over the place. And that can cause some stress. So what we like to do is encourage the use of an all done bowl. So having a bowl within their visual field, within their reach, that if they don't want that food, they can put it in there. And so hopefully redirect them from throwing it across the floor and making a mess and causing even more stress. And also with that is making sure that we're offering a food to the child that, has difficulty with exploring new foods, is making sure that they have at least one preferred food in front of them on their plate. We like to call that a safe food. Again, when we look at our plate and we see nothing on there that we've ever eaten before that we don't like, we might shut down. So we want to make sure that we offer them a food that they see that's safe for them, that they know they're going to eat, to hopefully avoid, this domino effect of starting to throw food around because I don't want any of it. So those are some of the strategies that we like to start out with families when we hear that the kids are throwing food or it's something that we observe.
The next major behavior that we see at meal times is the child having difficulty even just sitting down at the table and, seeing food at the table maybe and like running in the opposite direction. So how do you work on eating when your child isn't just even ready to sit down? So as an OT, something that I look at is the child's sitting position. So if they are kicking their feet or wrapping their feet around the chair legs or sitting up on their knees, or maybe they are not sitting at all and they prefer standing, I'm going to look at the height of their chair, make sure that they have proper foot support, that their feet aren't dangling, that they have a footstool perhaps, and make sure that they have a good solid foundation to support what is the optimal feeding position is 90, 90, 90. So 90 degrees at the hips, the knees, and the ankles, which is going to support the safest position for chewing, swallowing, using utensils, being good optimal position for mealtime. I've also seen a lot of kids sliding out of their chairs lately too. So just kind of looking at the heights of everything, if they need a booster seat, and what kind of works for that child. And then also recognizing that kids grow. So you're gonna have to reevaluate that seating system on a regular basis. So there are some expensive but worthwhile investments, some chairs that grow with your child, so that makes that a little bit easier. There's a Trip Trap chair from Stocky, I don't know how to pronounce it, and then the Kikaroo Height Right chair have been some ones that some of my clients have had success with.
It sounds like we should almost think of it like a bicycle seat. Like it's not like you set it once and then you don't have to think about it anymore. You have to keep. Right. Sometimes I'll look at my son and be like, oh gosh, we need to, your knees are above the handlebars. So you have to do something about that.
Yeah, and so another thing we see too out in the community is that a lot of families will be like, oh, my kid just snacks all day. And so if your child's just kind of eating snacks pretty consistently throughout the day, not getting that like lengthy break in between meals, they might not have the opportunity to like feel hungry. And so if we don't feel hungry, we might not be as interested in eating. So it's important to think and be mindful of when your child's eating. So maybe breaking up those meals more throughout the day. So making, you have breakfast and then waiting a few hours before you offer them a snack, so they can start to learn what those cues are being hungry. Like, oh, you hear their stomach growling, you can, give some insight into them, like, oh, that's your stomach telling you that you're hungry, and things like that. And this, plays into our interoceptive system, which is a fun term us OTs love to use. So it's just like our internal awareness of our body. So understanding those hunger cues, understanding, what it means when our bladder's full, things like that. So it definitely comes into play with some of our, some of the kids that we see out in the community for picky eating. So that's something definitely to be mindful of.
And the next thing we wanted to talk about was really diving into the sensory properties of food, and if being a little bit more sensitive to certain things or really enjoying other things, trying to be aware of that to try to pick some foods that could be more successful. So in general, I'm not sure like how much like background folks have on sensory processing, but there's patterns that we can see of someone being like very sensitive to experiencing sensations or really, really seeking other sensations. So in like a feeding sense, the child who is maybe a little bit sensitive, they might have that gag response as soon as they like see the food or smell the food, versus a child who is really seeking, they might really crave like bold flavors, spicy, sour, crunchy things that give them a lot more input. And there is kind of a hierarchy of accepting food. So Casey talked about like eating with your eyes first. Does the child tolerate the food in the same room as them, like across the room from them, on the table in front of them, or maybe a little bit outside of their space, and kind of how the child tolerates that food just visually. And we could think of like quantities of that as well, like how much food versus like, just a couple pieces. And then the next would be if the child is able to tolerate it, then maybe they can interact with it. Maybe they can stir it up with a utensil, or just manipulate it in some way without touching it directly just yet. And then next would be smelling the food, which sometimes happens at the same time as interacting with the food, depending on what food it is. Does the child tolerate that smell in the room versus like, are they able to actually like lean in and smell it like right up close? Next would be if the child's able to tolerate just touching the food, maybe just with one fingertip at first, and eventually kind of working the way up to even like touching with their lips, their tongue, and, you know, getting closer to tasting. And the taste could be a really small taste, just the tip of your tongue, or, you know, biting and chewing food and maybe spitting it out. That's also a really big taste, but not quite yet eating, which is that like last step. But there's so many steps to of working up the system of kind of tolerating interacting with a new food. So that's why feeding is so complex. So some strategies for helping a child to tolerate the sight of a food would be always having at least one safe food on the plate that you know that they would like. The child might not be able to tolerate the food directly in front of them, so you can do what we call using a learning plate. So having a plate off to the side that maybe has that new food, but they might not be ready to have it on their plate yet, but they're at least being exposed to it at more of a distance. And then of course, like not having like huge heaping portions of a new food, it's probably going to be easier to tolerate a smaller portion at first. In case you can give strategies for smelling new food.
Yeah. So our sense of smell, some children might be oversensitive to certain smells. So some strategies are you can teach the kid to kind of fan the smell away from them so they can be a little active in that. Making sure you're just offering foods that have more of a mild smell if your child is oversensitive to those smells. And then knowing if a food does have, you know, a stronger smell, just being mindful that you're opening it kind of away from the child, maybe, you know, on the other side of the room, just so that it has time to kind of disperse throughout the air so it's not so strong at once. And then in terms of touching, some kids just, you know, don't love like maybe how cold or the sliminess of food is. So having a paper towel and teaching the child to, you know, wipe off that, you know, extra liquid or whatnot so they don't have to touch it. Making sure that they use utensils. So even though it might be a finger food, they can still use a utensil if they feel more comfortable interacting with the food that way. Always having napkins, wipes nearby that if they don't love messes on their hand, that they have the opportunity to remove that so that they can kind of keep that calm state throughout the mealtime. And then just making it fun by doing like food art. Just, you know, again, going back to that, playing with the food. So that way they're being exposed to the touch and touching the food in a positive way if they're just not ready to eat it yet.
Some strategies for helping kids be more successful with tasting some new foods. Hopefully if you're having fun and, you know, there's not working your way up the steps, you are like setting up for success for tasting new foods. But something that can be super helpful is sticking with foods that might be similar to what your child already enjoys. So something that has a similar flavor or maybe a similar texture or color to something that the child already enjoys. And then maybe changing like one small thing about it so that it's slowly and gradually exposing the child to some different foods and some slightly different flavors. And then also just being mindful of the types of textures and flavors that the child does seem to like and maybe doesn't seem to like. And just being mindful of like, are they really into like more sweet things or more crunchy textures, and trying to find some other snacks that might be similar. Just kind of roaming the aisles of the grocery store, I very much enjoy the gluten-free aisle. Has a lot of very interesting snacks that can be super helpful to try. And yeah, that's about it for the sensory properties. I'm hoping we get some good questions for Casey and I regarding that. And I guess we can open it up to questions.
Awesome. Kara and Chris, I think we have to go back. Kara, you're going to give some tips for the next age group, and then Kristen, I think, for the oldest ones. So we started down and we'll go,
okay, gotcha.
Go back up. But that was all really specific and super helpful. And we'll keep it going with Kara. Thank you both.
That was great. Love all those strategies. And a lot of what you're going to hear, I'm not going to repeat the same thing just for time's sake, but a lot of the strategies that a speech therapist can do Casey and Alyssa can do as well. We kind of tag team off of each other. Similar tactics, food play, food trust, all of that. But one of the biggest things I really wanted to talk about was, I always call it ARFID because I just hate saying the whole word, but you guys know the avoided restrictive food intake disorder. There is a really big psychological component here, as well as nutrition. So, you know, it's not just your typical picky eater who's, you know, there is a psychological component typically that's kind of wrapped in here. And a lot of times they have comorbidities. So they have other mental health disorders, typically anxiety or something like that, that is associated with this. And there are some studies shown, and I can always send that to you, Erica, if you wanted to link it. But typically they're showing that the average age that this kind of diagnosis happens in treatment is in the adolescent age, give or take. There is no certain age. It can happen in toddlerhood. Adolescence can also happen in young adulthood as well. So knowing that this can span across a lifetime is really important. But let's kind of dive into this specific age range and some of the psychological things that I want to kind of touch on. So like I said before, the treatment is multidisciplinary. Very, very important to have a team around you of a nutritionist, an occupational therapist, you know, a psychologist as well. And why is it important to have those? Because like Casey and Alyssa touched on, feeding is a massive, massive job that we all do throughout our day. So there's a sensory component, there's behavioral components, there's all of that. So it's really important to have that team together. I find that the driving force typically is a psychologist. And why? They're not necessarily telling us what to do, but they can guide treatment because typically there is an underlying psychological component for some of these adolescent children. And what we don't want to do as professionals is make it worse. So if there is anxiety and I'm, you know, trying my best to get them to be comfortable and, you know, I'm not treating the anxiety, right? It's not my job. So we need to have the professional there that can help cope with some of those psychological factors in order to guide our treatment and to better help the child. So making sure that if your child does fall into this category, that you have a good psychologist that is okay with talking to your team members, you know, all the ones that are here today. And why do we typically, a lot of parents will say like, well, why is it eating? Like, why do we see this with our meal times? And I like to say it's because it's really the only thing that our child can control throughout their day, right? Like nothing else in their day is controlled by them. They tell them most of the time that you can
Pooping.
Yeah.
We see it with pooping too.
Yes, and we're dealing with that in my household right now too. So might be coming back to you, Erica, soon. But so it's one of the only things in their life that they can control. They can control as a child what goes in their mouth and what comes off their plate, right? So as a parent, we can control when we offer, what we offer, where we offer it, right? All of those things. But the one thing that they can control, and when we have other psychological comorbidities, you know, control is a big piece of that. So one of the things that they can control is their eating, what goes in their mouth and what doesn't. The other thing that we can see with this diagnosis is fears. So fear of choking, fear of vomiting, fear of getting sick, fear of, you know, how I have a little girl right now who's just scared of like how things might taste. She has no clue. She's so scared that what is this going to taste like and what is this going to feel like in my mouth? So fear is another big component for some of these adolescent children as well. So typical goals for treatment would be decreasing the stress and anxiety and increasing participation, interaction, and interest. And that, if you notice, I didn't say eat, right? Our goal is, of course, our end goal, our optimal goal is, of course, we'd love them to eat this new food, but we have to really accept or set realistic functional goals, with the optimal goal, of course, is eating, but we have to think about functional and functional goals for that child in the moment and kind of adapt those goals as that child progresses. So, you know, like Casey and Alyssa touched on, some kids might be ready to hop into like, I'm gonna take a bite, I'm gonna be okay here. Some kids need to start with touching just with their fingertips, some with their palms, you know, all the great stuff that Casey and Alyssa touched on. And some might just need to tolerate that food, you know, at the table. Maybe it's even in the room. Like I've worked with some kids, okay, it's over here, it's not even on the table, but it's over there in the corner, and we slowly work it closer to the table. So the range is massive. And you can already see I've touched on so many multiple team members already. And so the treatment needs to be guided by all of us as well. So another main goal, like we said, is exposure. Trusted exposure is what I always say. It needs to be built on trust, a trusted exposure to these new foods, and then while we desensitize the child to these feelings of fear or anxiety around this food. Casey and Alyssa touched on a lot of it, but food play is a great important part. We pick foods that typically what we call food chaining. If you guys, there's a great book on it, but we pick foods that are in their repertoire and we chain them by common characteristics or common characteristics of these foods. So, you know, we start with a goldfish and then we maybe go to a Cheez-It. It's similar taste, similar colors, different shape. And that evolves into different types of crackers and then maybe chips or something like that. So it's a chaining effect. So we start with something, one that they trust. And you'll hear me say that word a lot because I think it's one of the biggest components for this treatment. Sorry, I can't read the comment, but Eric, are you answering things as we go?
Well, I just told them to put them in for the end, so you don't have to look at them right now.
Okay. Kind of forgot where it was, but I think I was talking about food chaining, trusted foods, starting with trusted foods, and then being able to expand, right? So if we just threw that Cheez-It on there and they were like, man, that's not, I don't like it, that's not, but hey, can we go back? Let's start with a food that you love. What color is it? What shape is it? What does it taste like? What do you like about it? And then we pick something that is similar in many ways, but maybe just different in one aspect. Maybe it's the shape. You know, even the Annie's. Annie's has cheddar bunnies. It also has the Cheez-Its that literally taste the same. They just happen to be different shapes. So you're continuing that building of trust of like, okay, there's one thing that I need to kind of take on here. I don't need to take on this whole new food and all the tastes and shapes and colors and smells. We're just chaining to something that they trust, starting with something they trust and chaining it a tiny bit by switching one characteristic. We also do food interaction that we talked about too. It might start with meal prep and then setting the table. It might begin or end with just cleaning up. And we, you know, touch the food if they tolerate touch. Okay, we're just going to pick the apple up and we're just going to put it in the trash. And that's the most interaction they get that meal, and that's fine. So we're meeting the child where they are along that steps, those steps that Alyssa and Casey touched on, figuring out where they are, and then we're slowly working our way up through this trusted exposure process. The other thing I love for this age is food journaling. So we typically will make like a food book and we add the new food that we talked about that week. And we even make a little graph. It smells like this, it tastes like this, you know, it feels like this, it looks like this, it's similar to this food. And if they end up trying it, you know, we kind of talk about it. How did that make you feel? What did your body feel like? What did your mouth feel like? Did you like that food? And simply like, would you be willing to try it again? And they can circle yes, no, maybe, I don't know, and kind of write their comments in there. What does that do for them? One of the biggest things is this control factor, right? So food, they can control what goes in their mouth. So this is giving them, we're allowing them to have control over this entire process. We're not telling them you need to eat. You're not telling them you have to like that. That's also very important. It can be a very open, candid conversation, especially at this age, about these foods and, you know, about their feelings, about the food and how that experience made them feel. I also like to use the book so that after we have tried a bunch of foods and they have this book that's growing, and, you know, parents can then say, you know, they don't have to like fight about what foods, and, you know, they can say, go grab your book, your food book, and you're going to pick one food that you're going to have for snack today. So that child then feels in control. They can go to the book of these new foods that they've experienced, and they get to pick something. So a lot of kids at this age think it's fun. They love adding new foods, which can be a motivator as well. And it's a great parent tool for carryover to kind of use it as a, you know, limiting the fight of back and forth of what are you going to eat, whatever. Go pick. We're making dinner. I want you to pick one fruit from your book that you've tried with, you know, your therapy team, and we'll have that at the mealtime tonight. We also obviously create mealtime boundaries. So that means time limits for meal times. What should a mealtime structure look like? Should it be an hour? Should it be 10 minutes? Where should my child fall? We would really love for your child to be around 30 minutes. I'm a mom. I now understand that it has to be a give and take. Can't be a hard cutoff. If it's 40, it's okay. If it's a little bit before, that's okay. Why do we not want this to go on and on and on? Depending on age, there's many different reasons, but we want this mealtime routine to be fun and engaging. And usually when we get past that 45-minute mark, it's typically because of negative mealtime behaviors, right? Most of the time, we're having a pushback. We're going back and forth with the give and take. And we can just leave more room for difficulty. So we do try to say 30-ish minutes would be your mealtime boundary. Preferred foods versus non-preferred. The other girls made a great point of always having a preferred or safe food on your plate, whether that's 1 and 2. And I typically say at mealtimes, especially those mealtimes that happen to be difficult for parents, having 1 non-preferred foods on that plate. That is it. We don't want to overwhelm them with 3 different foods they've never seen before. Picking 1, and it might be that one that you picked for the week that you're going to continue to work on as carryover. Also on that plate, we really want to think about portion sizes. One of the biggest things that I tell parents is if we overload that plate with that non-preferred and we give them a massive portion size, it is visually overwhelming. It is, sensory girls can say, like, visually, I mean, the smells, it can be so much on their system. And typically we will see kids just immediately write it off just based on what they're seeing. So 1 tablespoon per food group per year at a meal is like a minimum. So I usually say minimum, just offer 1 tablespoon if they're 1 year, if they're 1, 2 tablespoons if they're 2, and so on. So if you have a 5-year-old, you can do 5 tablespoons. They might even need less than that if it's still a new food, and that's okay. But just remembering a small portion size of that non-preferred food is ideal, as well as for preferred food too. If you're finding that your kids are kind of giving pushback on you, start with a minimum offering, and you can always add more as they go. It also gives you a better guideline of what they're eating. Many times parents are like, they didn't eat anything. And when we really think about the portion size, they really did eat a pretty good amount. So always having that portion size in your mind as you're serving your child. And of course, parent language. As a speech therapist, language is my thing, right? So we talk a lot about our responses to our child's behaviors. What do we say? What shouldn't we say? And of course, I'm sure a lot of you know already that, we don't ever want to be forceful and say, we're taking a bite, you need to do it. Take a bite, you should do it. But not all that language should be out the door. And it's really difficult, even for therapists. I'll say that probably all of us still have to work at our language, even in a session. So it's a new language that parents learn. We've modeled that language for them so that you can watch, take in, and then do. But knowing that it takes time, don't feel bad that, I'll say it to my toddlers, I'm like, come on, let's take a bite, you got it. And I'm like, well, there we go. So know that it happens, know that we are not going to be perfect, but it's a work in progress for all parents, but extremely important to think about our response and our language during our meal times. The girls talked about an all done bowl, which is great. Having that all done bowl on the side for if they are throwing, of course, but also if they are just all done with that food, right? Tonight at my table, I had a 2.5-year-old. I'm all done with my apple, and he's throwing it on the table. I said, well, here's your bowl. You can just put it in the bowl or on your plate. Those are your 2 choices. And he put them on the bowl. Eventually he went back and actually started eating them. But having a safe space for them to put their foods, whether that's because they're throwing, that's because they don't like it, or because they tried it and decide that they don't really want any more. All of that is okay. We can't tell them you have to like it, you need to eat it. So that was great trying, and you can put it in your bowl or on your plate and just leave it at that. So having those safe spaces on your table is really important for your kids, and knowing that can be okay too. We also, of course, look at just overall daily routine of your family. I find so much information, especially with this diagnosis, by asking, what is your child's daily routine from when they wake up, what their naps are, when they're eating, what their snacks are, what their liquid intake is. So a lot of times I work with even someone like Erica, we work on sleep, we work on, liquid intake. Maybe they're drinking too much milk or they're drinking too much water, right before a meal. So we do try to structure your day to help optimize their hunger windows and make sure that they are sitting down at that table optimally hungry, so that we aren't sabotaging their meals by, grazing throughout the day or drinking big bottles of milk, all of that. So it's one of my favorite parts of helping families kind of dissect their day, piece in feeding here and there. And even just with a simple schedule switch, sometimes we can see a difference in children that are having some picky eating behaviors. And also parent caregiver engagement and parent caregiver stress. We touched on it before that we're here for you just as much as we are for the kids. Mealtime is stressful. We also know that kids feed off of our stress, right? So that's a lot of times why I see families seeking support, because we get to this point where we realize, like, man, like my stress and anxiety about this can't be great for this mealtime routine. So supporting parents through all of that, helping them get the help that they need if it's necessary, and helping to decrease that stress and anxiety at the mealtime so that it's just a happier, healthier place, so that we can see some growth. I think that's it. I just talked for way too long, but I think that's it.
No, it was great. We love it. I love that you picked different things because I know you could have said
I tried. I was like writing stuff down. I was like, I got to touch on something different.
There's a lot of
we all are one and the same. So
yeah, that was really, really great. All right, last but not least, we will go back to Kristen. Some of our parents have preteens and teenagers, and maybe some of those tips are going to be a little too young for them. So what do you have to add to the mix?
So first I want to say, Kara, I think I might steal your book idea. I've been having my families kind of keep a poster or something to hang on the wall, but I really like the book idea, or maybe I'll have them do both. I don't know. I also want, so all of you, I think, mentioned something similar to what I've said to my families, which is that food can be so overwhelming in so many different ways, and visually it can be super overwhelming if there's too many different things, too much of something they don't have any interest in. It can just be totally overwhelming. And so I've started using the term they're visually full, and that's resonated with some of the families that I've worked with. One of the things that I took away from my experience at Children's Hospital was that the families were there for 4 weeks. And during that 4 weeks, they were sort of a captive audience, and our intervention with the children was what was happening. And a lot of times we had success during those 4 weeks. And then they went home. And sometimes the success was not carried into the home. And my takeaway was that the families weren't always there with the same goals and treatment plan ideas as we were. And in that environment, there's not always that time to spend the time really fleshing out, this is what we're doing, this is why we're doing it, this is what you can expect to improve, how your life will improve if you are committed to this goal. And is this a feasible goal for you in your home? And how can we help you bring it to your house and keep it going? In terms of older kids, I think that the way that you phrase things, the way that you think about their experience can go a long way in improving what's happening at the dinner table. Much like toddlers and preschoolers and young adolescents, older adolescents want to assert themselves. They want to control their environment. They have different temperaments. And if you have a child who has a long-standing difficulty with eating, by the time that they're an older adolescent, those are really embedded. Those, whatever the reason is, those anxieties or fears or just a desire to be in full control of their environment, that is very deeply embedded in them. And so if you are either still working on feeding or just starting or just beginning to address, hey, why can't we expand your diet a little bit? I think it's really helpful for everyone involved to take the time to kind of engage them in conversation as much as you can. Think about their temperament and ways that you've been able to gain their cooperation in other areas of their life, and kind of take the time to help involve them in the plan for eating. Try to figure out what it is that makes eating stressful. And I think, of course, that's the crux of the whole challenge with feeding, is really finding out the cause. And sometimes it's not clear. But I think the more that you can allow space for that and allow conversations, any education that they're open to, especially as they grow and become better able to communicate to you what they're feeling or thinking, and listening to them. Some kids really respond to, Kara mentioned, and I think that often is really a safer way for an older adolescent to express what they're thinking, even if they can write down, I really just don't like the smell of such and such. I smell it and then I just can't eat anything. And they don't want to say that to you because maybe it's embarrassing, or maybe they're having trouble formulating their own thoughts. But some kids will be able to write it out and then leave it for you to look at, and then you can kind of adjust what you're asking them. I also, some kids are, of course, this isn't true for all older kids, but some older kids might be open to talking to someone else about it and talking through why is eating hard. And of course, I always refer back to the pediatrician. Maybe there's something going on that, you've suspected for a while, but you just haven't quite found the answers. What I always say to families is, if you're looking for support or you're looking for answers, then you need support and you need answers. So don't give up on it, and don't take, he'll grow out of it as a response. Or if you're looking for support, then you need it. So, and I know a lot of the younger families, with kids with younger people with younger children often are like, well, is this really an issue? Yeah, if you're stressed out and mealtimes are still a struggle, even well into the teen years, keep looking for those answers. And don't be blown off by various people telling you it's not a big deal, don't worry about it. But with the older kids, I definitely engage them in the conversation and any education that they're open to. And maybe not with super older children, but like that preteen, young teenage age, I'm not above bribery. If it is a huge stress because your child's not eating and it's all you're thinking about, and you need them to cooperate, I am A-okay with creating some sort of token economy. And that can grow with them. It can start in the preschool years, and you can adjust it to more appropriate rewards and harder asks as they grow older. I know that's a little bit of a controversy, but I do come from a behavior background, and it can be a very effective tool. I don't think any of us are totally immune to a little bribery and positive reinforcement. That's my spiel.
That's your spiel. Okay, great. Well, thank you, everybody. We're going to see if there are some questions. I know we have one in the chat. If anybody has more, feel free to pop them in there. Also, this is a tiny group. If you want to just unmute yourself and ask a question, that's okay. Everybody must be on vacation tonight because usually it's so well attended. Amy, do you want me to read your comment and question off, or do you want to pop on and chat? Or are you even still with us? There. Give you a second to jump in. If not, I will read it off. Okay, I'll go for it. So Amy says, this is interesting. I can't wait to hear what everybody says. I think I know what you're going to say. One of the things my mother did 50 years ago was she made a deal with my brother. Since he didn't like the texture of cooked veggies, as long as he had the vegetables raw in the kitchen before dinner, he didn't have to eat that vegetable at the dinner table. They both felt they had a sneaky win with that one. The presentation reminded me of that, as well as the fact that with my older son, he found that he liked frozen peas best as a snack when he was a toddler because they were crunchy. I think with my food-averse younger son, I'll present him with a variety of modes of food, cooked, raw, frozen, cold. Is it a good idea? Is it too many options? He really won't eat fruits or veggies because they are slimy. Okay, should we go to you? We'll go in the order we were in. Kristen, do you have any comments on that multi-phase question from Amy?
I think it's a great idea to expose him to all presentations of a certain food, as long as it's not a choking hazard and you're comfortable with how it's presented. I think, the more exposure, we all have preferences, and I think it's okay if he likes something cooked one way or not cooked, or prepared in a certain way. Yes, more exposure, the better. I think that tempering our own expectations of how, you prefer something cooked one way, but your child might like it another way. And I think if you are able to offer that, that's awesome. And I think if you're able to sort of change your expectations of how he's going to eat a certain food, then I think we both win.
Yeah, and the sneaky win sounded like the choices or the empowerment you were talking about using with older kids. You can either have it at the dinner table later, or you can sort of, sneak it in now. Does anyone else do you want to speak to that, or does anyone want to speak to that?
Top in real quick. I was going to say, feeding off what Kristen just said, was optimal, like I mentioned before, like optimal versus functional. Of course, we would like our child to eat a variety of veggies with all different consistencies, and we love them all, but it's just not functional for most children. So if you do have a child who is resistant to veggies or fruits, and you find a certain texture that they really enjoy, go for it. That is great. They don't have to love all different types of textures and consistencies, but that doesn't mean, like Kristen said, that we just stop exposing them to that. It can be an activity. One of your activities could be, all right, we have this carrot. There's a couple of different ways we could cook this. What do you think it's going to be? We can have a hard carrot and we can have a soft carrot. And kind of go through, steam it, cook in the microwave, like do all the different things, bake it, throw it on the grill, just do a bunch of different things. And that could be your little taste test. That some might find that fun of like, oh, this one is a little bit soft and I really don't like that. But like we all mentioned before, continuing those strategies and the language, that it's okay if you don't really like that, but I love that you're trying that. But again, functional versus optimal. If your child has a preference, you really want them to eat fruits and veggies and they happen to kind of pinpoint on a consistency, all good.
Awesome. Anybody else want to chime in on that?
Just definitely agree with both of them. Again, it could just be raw vegetables are better because they're crunchy and I need that crunchiness throughout my day versus something soft. So a vegetable is a vegetable, I think, at the end of the day, probably for most parents. So whichever way the child's going to accept it, but again, continuing to expose.
Yeah. Amy, I love that you're thinking of how different ways to prepare the fruit or vegetable is going to change the texture and the child's maybe willingness to try it. I would also add into that rotation, so you said cooked raw or frozen / cold. If he's not liking the sliminess of fruits and vegetables, I've had a lot of success with dehydrated fruits or freeze-dried fruits. So they pretty much just have all of the moisture sucked right out of them and kind of are still the same flavor. And even like the freeze-dried strawberries still have all the little seeds on them, like looks like a slice of strawberry, but it's totally dry. And then if you are going to offer like a few different modes of like the same food, I would also just make sure that you still offer like one preferred food that's maybe like the same color or something that will be tolerated.
Awesome, great. Anyone that didn't chime in on that? I guess that was everybody that wanted to. Okay, cool. So Rachel is asking by bribery. So Kristen, I think you were the one who said you're not above bribery. Can you explain what you mean by that? She's asking, do you mean like if you try this, you can have a blank like an M&M? Or if not that, what do you mean?
So, in the simplest terms, yes, that's what I mean. However, I would not jump to that. When you think about the motivation to eating, there's internal motivation, there's external motivation, and it really comes down to your comfort level and what you're willing to do to get your child to eat, and if it's necessary. So if we were working together, I would spend some time just kind of figuring out what your child's diet is, and if it is imperative to you that your child expand their diet, and they do not have the internal motivation to expand their diet, and this is a goal that is really important to you, and M&Ms are very rewarding to your child, then I might suggest that if you want them to try a new taste, you offer them something that they're willing to do it for, because they might not otherwise do it. And if that is a simple way for you, and it may or may not be, I would want to talk more about the situation, but if that was one of a really easy way to get them to taste new things and sort of expand their palate a little bit, then I would say yes. But that is, the crux of what I meant by bribery, a reward. You're asking your child to do something that they don't want to do, and you're offering something that they want in return. There is a school of thought where you should not reward one food with another, and that's totally acceptable thought. And some people agree with that, and I think it really just depends on the situation. You can also use non-food items, or I spoke a little bit with the older kids using a token economy, and you can use anything. You can use stickers, bubbles, whatever it is to keep track of you did something that I want you to do. I know it was really hard for you, and here's something that I know that is going to make you feel positive about that. So that's what I meant by that.
Awesome. Thank you. Does anybody else want to weigh in on bribery / rewards / incentives, whatever word we want to use? Or has that been covered?
I can just quickly say a quick statement. Yeah. I think one of the big things too is taking the word bribery and using like that token system, just so that people don't feel like they're bribing their kids. But one of my biggest things too is always saying, like, I have a toddler who will eat mac and cheese for 5 days in a row and then throw a hissy fit one day and just won't eat it anymore. Will I use the token system then and say, I know that you love this food. You have no issues with this food. It's one of your favorites and we've never had an issue before. Yes, I'll give him some stickers. Here's 2 stickers. We're going to take a bite. Would I use that for a new food that I've never seen him eat, that he's never been exposed to? Then I would kind of pull back on the token system and do a more like, hey, like, let's kind of talk about this food and experience it on your own and in control. But a token system is amazing for that. Those foods that you're like, you're just deciding today that you don't want to eat this, not necessarily a new food. That's kind of my 2 cents. But.
Awesome. Great. I find, I'm not a food person, but I do the potty training, and when there's true fear of the unknown present, there's almost no reward that's going to have any kind of effect on that. So I feel like it kind of depends on the situation for sure and what the issue is. Okay, Rachel also wants to know, so what do we do if our child digs their heels in continually and will not try anything that isn't a safe food? I'm trying to take emotion from mealtime, but I fear in doing that, I'm not encouraging him to try new things. Rather, I just give him a rotation of what's safe to him, so to prevent any argument. Do you want to do that first, Kara, since you're here?
Yeah, sure. There's plenty of ways. I'm sure the other women will give some great suggestions and strategies. I think my first reaction is, especially as a parent, I'm like, I know how hard it is to go into these meal times and stress about, I'm just going to give them the safe things. So I totally understand that. And what my first suggestion would be, can we shift our mindset and pick like a a phrase for ourselves that we can go into a mealtime. You don't have to worry about anything else but putting a non-preferred food on a plate. And you simply say, you don't have to eat it. You can, and finish the phrase. So you can build a tower. You can put it in that all done bowl if you would like. You can give it a kiss. So you're giving room for one, you're stating for yourself, but also for your child. So you're saying it out loud for both of you to hear. You don't have to eat that. And the second part is, but you can, and then kind of fill in the blank with whatever you choose in the moment. And that could evolve as the mealtime goes on. Well, he says, oh, well, I don't have to eat that. Okay, I just have to build a tower. Awesome, I'll build that tower. And you continue, you might say back, oh, I'm still not gonna eat it. Okay, you don't have to eat it, but can you count them? And you count them together. So you're building this activities throughout the mealtime and continuing to say to yourself so that you can trust that statement, and so can he, that like, you don't have to eat it, because he doesn't. We can't force a food. So it's good for yourself to hear that, but even more important for him to hear, mommy's not gonna make me eat that food. But then you're going into, can we do some positive interaction and positive play with that food?
Yeah, I definitely agree with Kara. I think, going into the mealtime and understanding that, like, you're making sure you're giving them that safe food because that's what they're going to eat. So they're getting, some nutrition. But that exposure, regardless of if they're just touching it, how they're interacting with it, is what's important. If we don't expose them to the food, they're not going to know about it. They're not going to feel safe around it. And they say that sometimes it takes 10 to 15 times to be exposed to a food before we actually feel super comfortable around it. So thinking of it from that perspective, that again, the expectation might not be they might not eat it, but they're exposed to it and they feel safe and comfortable around it to hopefully get to that point where maybe they take a bite and realize like, oh, this isn't so bad. So I think definitely thinking it from that perspective, as Kara had mentioned.
Yeah,
I would just say that
go ahead.
Go ahead. Sorry. Go ahead, you go.
Oh, okay. Totally agree with Kara and Casey. Like kind of changing the perspective, like don't think of it as you're not encouraging him to try the food, but working your way up to that. I also like that you're doing a rotation of the safe foods. And not like doing like the same safe food like multiple days in a row. I think that's great. And another thing you can try would be with those safe foods, is there a slightly different way you can offer it or present it or cut it so it's a little bit different too. And then also thinking back to food chaining. So with whatever that new food is it something that is similar perhaps to something that is a successful and preferred food, and trying to just increase those chances of acceptance that way too.
I was just going to say, if it's with every single new food all the time, I would just start to think about and look at patterns, look at his day and his week and what's going on in your life and his life. If he is sensitive to all new experiences, even outside of mealtimes, what his person, I would just want to gather more information to see if we could maybe identify a reason, and maybe you don't know what the reason is, for why new foods in particular are consistently difficult.
Excellent. Did we miss anybody that wanted to speak to that? Awesome. Yeah, she said there's anxiety around many things, especially food. So Kristen, or anyone really, if in hearing that then as the reply, since you're the one who kind of decides what avenue families are going to go down, what does that make you think of? Like, what are some things that could be underlying that?
Well, again, it's hard to know without, more information, but I would just spend some time just talking about his general personality and what his response is when he's feeling anxious, how he approaches other new experiences. There could be sensory things going on. It could be very overwhelming when he comes to the table and it's a new experience and he's seeing something new, and now he's thinking about that he's got to pick it up and eat it and do something with it, and he just kind of shuts down. So I would, want to spend some time figuring out what his typical reactions are. And I probably would, my initial gut is telling me I might make an OT recommendation, or even, psychology, or, maybe anxiety is so prevalent that it would be helpful to have some tools for managing anxiety through the course of his day. And then that would help at mealtimes as well.
Awesome. Okay, so for our parents that are watching, and I know there's a few of you tonight, were there any questions or comments that you wanted to make that we did not get to? You can pop it in the chat. You can unmute yourselves. I'm happy for who was here. I guess we are so deep into the summer that our group is on vacation. They all said they were coming, but they must have been on vacation. But we will make this recording available. I know it's going to be really, really helpful and valuable. All right, well, I don't see any additional questions. So I think, and based on our time, we've taken up enough of everybody's evening. Thank you so much to our experts for generously sharing their time and expertise with us. And thank you to you parents for attending. If you want to connect with any of the experts, I did put their website links in the group. They're also group experts, so you can find them in our group as well. Rachel says, honestly, I just wish I could have all you ladies come to my home for mealtime. Right? Maybe they can cook for you too. And Amy says, thank you. Awesome. All right, well, I'm going to wrap up the recording here. I believe next week we have this chat with our neuropsychologist, so that should be really exciting too. Thank you to our parents and our experts, and we'll see you all guys all back here very soon. Have a great night.